Hi, I am Dr. Nikam. Welcome to Atrial Flutter. What is atrial flutter? How does it present? What kind of symptoms people experience? How is it diagnosed? What is the treatment? And what is the prognosis? Here is a picture of a heart. We have the two upper chambers known as the atria or atrium for a single chamber. Then we have the two ventricles, the right and the left ventricle. The upper chambers contract, and that is followed by the contraction of the lower chambers. The electrical activity of the upper chambers and the electrical activity of the ventricles is represented by the electrocardiogram. Normally, if you look at a normal electrocardiogram, here is an atrial contraction, which is represented electrically, that is followed by a ventricular contraction. For each atrial contraction, there is a ventricular matching contraction. Whereas in patients with atrial flutter, instead of having 1-to-1 ratio of the atrial and ventricular contractions, what we see here is the atria are contracting at such a fast rate, only every third or the fourth atrial contraction is transmitted to the ventricular activation. As a result, we see there's a block. And this typical sawtooth appearance of the atrial contraction is characteristic and diagnostic of atrial flutter. Normally, in atrial flutter, the atrial rate can range between 260 to 320. In majority of the cases, the ventricular rate is much slower. Occasionally, it could be 1-to-1 conduction where the atria and the ventricles are beating at a rate of 260 to 300, which is very, very serious. But normally speaking, every fourth beat is conducted to the ventricle. As a result, the heart rate may appear to be normal, but there may be underlying atrial flutter. Sometimes when patients come with sudden onset of palpitations or fluttering in the chest, there may be a what is called 2-to-1 conduction, that is, every other atrial contraction is transmitted to the ventricle. The ventricular rate can vary anywhere from 130 to 150 per minute, and that can cause more significant symptoms. Let's talk about symptoms. If the ventricular rate is not very fast, patients may not feel anything. Unless you do an electrocardiogram, you may not realize that you are having atrial flutter. However, if the ventricular rate is very fast, in the range of 130 to 150, then you may experience palpitations or fluttering in the chest. If the rate is too fast, it may be associated with sweating, weakness, or dizziness. And with the sudden onset of atrial flutter, which can come and go without any warning, the symptoms are more pronounced than if someone had a chronic atrial flutter with a controlled ventricular rate. How do we diagnose atrial flutter? The best way to diagnose atrial flutter is with an electrocardiogram. If someone walks into the emergency room with a rapid heartbeat or a palpitation, and when we do an electrocardiogram, immediately we can recognize the presence of atrial flutter. However, if the rate is fast, sometimes it may be not easy to determine the underlying arrhythmia. Now let's talk about common treatment options. If someone comes to the emergency room with a very rapid rate and you see the heart rate is 150, there's always a question as to, is this atrial flutter or is this regular sinus tachycardia? However, doing a carotid massage can reveal the presence of atrial flutter waves. If it's atrial flutter, it is usually converted to sinus rhythm with medication such as adenosine, or sometimes if the rate is too fast, an electrical cardioversion may be needed to stabilize the heart rate, the rhythm, and the blood pressure. If the atrial flutter is chronic with rapid ventricular rate, sometimes medications such as beta blockers are used to control the rate and the symptoms. The most definitive way to manage atrial flutter is through catheter radiofrequency ablation. That is, multiple catheters are placed in the heart, and these catheters monitor the electrical activity in the right upper chamber and identify extra electrical connections that may be causing this rapid electrical circuit. Once this extra electrical pathway is identified, it is frozen with radio frequency waves, thus eliminating the arrhythmia permanently. Patients with atrial flutter are more prone to develop blood clots that can go to the brain and cause stroke, and hence these patients need to be on blood thinners until the arrhythmia treatment is established and an attempt is made to convert the rhythm into sinus with medications and or catheter ablation. As always, consult with your physician for any kind of cardiac arrhythmias, because they can be very symptomatic and they can have long lasting effects not only in the heart but also on other systems in the body. And please subscribe to this channel. I am Dr. Nik Nikam. Thank you.